It's interesting, though. Increasingly around the country, not in national news outlets like that, but we are seeing around the country that local news outlets and local officials, too, are only keeping one eye on that larger national picture that you see reflected in those acute ways in national media. You see local officials and local media keeping one eye on that larger national picture, but only one eye, because really the other thing they've got to focus on is the fact that things are getting really rough locally at home. And this is something that is apparently not really a national news story yet. But if you look around nationwide, you can start to see this story grow from the ground up. Reuters reports today that over this past week, 20 states have had rising case numbers of coronavirus. And whether or not 20 states having rising case numbers sounds good or bad to you, it's definitely not good that the week before that there were only 13 states that had rising case numbers. So that number rising to 20 states with rising case numbers week to week, that is not good. It means our epidemic is going in the wrong direction. The state with the worst weekly rise in cases last week was Alabama. Weekly increase of 28% in their cases. Alabama, we have frankly been pretty worried about the hospital capacity in Montgomery, the state's capital city. ICU capacity has been filled in Montgomery, Alabama hospitals for days now. They are not able to take in additional ICU patients into ICU beds anymore. They are stashing what would otherwise be ICU patients indefinitely in emergency rooms in Montgomery area hospitals. That is not ideal. The pressure of what's going wrong in Alabama, though, is not just being felt in Montgomery. We are now getting alarm bells from the University of Alabama at Birmingham and their health center there. We're also getting alarm bells from places like Tuscaloosa, where the local hospital has doubled its number of COVID patients in just 1 week, and where the mayor of Tuscaloosa is now urgently warning the residents of his city to please do what they can to slow this thing down.
An alarming spike in the number of COVID-19 cases in Tuscaloosa County over the past week.
Tuscaloosa Mayor Walt Maddox taking to social media to alert the community to the area's largest single-day increase in new COVID-19 cases, jumping nearly 10.5%, more than 50 new cases in Tuscaloosa County on Monday alone.
I think we've entered a very dangerous stage of this fight against the coronavirus, because I think we're becoming more relaxed in what we're doing.
And with such a sharp rise in cases here in Tuscaloosa, Mayor Maddox says he's concerned with the number of patients being brought into DCH.
In the past week, we've had a nearly 100% increase in those with COVID-19 being in our hospital system. We were at 63 this morning. We were at 32 this time last week.
As hospital capacity becomes more of a concern, Maddox is asking the community to take social distancing seriously and to wear a mask when around others.
Think more of just yourself. Think about your family. Think about your community.
Doctors at UAB say they're becoming increasingly concerned about the rising number of COVID-19 cases in Alabama, which they attribute largely to more people being out and about.
This is a little bit concerning to us right now in terms of the trend, because our ICUs are fairly full right now for our COVID cohorted patients. So we are putting patients that have the same infection on the same unit. And so we've had to open some of these beds up more, mainly to help care for these patients more. And so if this continues, we'll have to think about opening up more units as we can.
Our ICUs are fairly full right now. You know, Montgomery, Alabama is worse off than Birmingham, where you just saw that doctor speaking from. Montgomery tripled its case count just since May 1st. Montgomery's ICU beds are full. We had been watching State of Alabama really worrying about Montgomery. But now we're seeing even in Birmingham, which is not the worst off in the state, they're saying their ICUs are pretty much full right now, and they are having to plan for building out more capacity now because the trends just keep getting worse. I mean, that's what happens. That's ultimately the way you have to live and the way you have to cope when your new daily case numbers look like this. This is from the Alabama State Department of Health, their website tonight. And it's not just an Alabama story. I know the big national picture is, bleak, and it's this landmark moment, and it's kind of hard to look away from if you're not watching Fox News, in which case it's very easy to look away from, apparently. But I think if you really care about what's happening with this moment for our country, in this moment in American history, at least for right now, I think you do actually have to look away from the national picture for a second to get a real sense of where we are. Because where things are going pear-shaped, where things are getting rough, right now you really do need to track it through the local news. And this is part of what's wrong in our media ecosystem. This is what happens when a national phenomenon in America moves off the coasts and out of our media capitals. The national media stops tracking it in exactly the same way. But if you look beyond national media coverage, if you just look at what's out there in the States, just look, it's there.